Is it allowed?
And then go back to this one to go.
Okay, we're live now.
Are we live?
Yeah.
Yay! Big delay.
That's okay.
We're here.
Good afternoon, everybody. Happy Tuesday.
Yay.
Dr. Hyde here. Dr. Brenda Hasbrock here with the Wellness Way Houston Memorial.
Hi guys. Good afternoon.
So today we want to talk to you guys about x-rays. Like, why x-rays? We take x-rays on our patients' first visits.
Yeah.
And I know some of you people may have not been used to that before. Maybe you have, you've heard of it and you think it's weird and you want to know why we need x-rays. Mm-hmm. So we just figured we'd talk to you guys about it and kind of go over that.
Yeah, so our motto at the Wellness Way is we don't guess, we test. And x-rays are one of the first, where's my hand? X-rays is one of the...
You're on this picture.
No, I haven't switched.
Oh, okay.
X-rays is one of the first tests that we do. There's a lot of information that we can glean from the x-rays. I don't know if you can see our poster behind us, but the big wheel in the middle, we talk about the Swiss watch principle at the Wellness Way, so that you're not just a heart, you're not just a GI tract, you're all these gears interacting together, so we can't just separate them out. And the biggest gear you'll see there is the nervous system. So one of the ways that we can test the nervous system and get some information right off the bat is taking some x-rays. Okay, and then the second gear that we want to look at that we can glean some information from the x-rays is also immune system. So we're going to just kind of show you what that looks like and what we're looking for when we're looking at x-rays.
Yeah, so I kind of want to show you guys a normal anatomy of the neck. So this is a picture from the side of the neck looking that way. So we'll just flip that one over.
Yep.
So you can see there's a nice curve here on the cervical spine. So this is the front of the neck, this is the back of the neck, and that curve is really important because it has a specific degree to where it really takes the impact, so everything, the forces are distributed equally, and then there's less stress in the body that way. So these are your little vertebral bodies, all your vertebrae, and then in between there's that white and empty space, and that's where your disc is. Mm-hmm. So we like a good space in between there. That way there's a little bit more cushion there, and then there's more room where the nerves exit, which is going to be right over here in the back.
Yep. So
this is a good one and nice, healthy person.
Yeah, and when we look at the neck curve, we say we want it to look like a banana curve. Banana. Should be the shape of a banana. We should have a nice curve from the base of the skull back to where the shoulders and the head and the neck meet. Okay. So when we talk about nerve supply and structure, we also give this little chart to our patients. Here we go. And it's called the spinal nerve chart. The spine is kind of like a breaker box. So at each level of the spine, the nerves come out there. They have specific parts of the body that they go to. So when we're looking at the neck, specifically, right up here at the top, it can be headaches and migraines. It can also affect blood pressure, sinuses, allergies. As we get a little bit further down, throat, it can be thyroid, neck muscles. So there are a lot of things that are controlled by that nerve supply in the neck area. So very, very important. And if we can take a look at that and see that good curvature in there, then we know that things have a better opportunity to function more normally.
It's really cool to see structurally what's going on inside of a person mm-hmm. that you may not be able to see by looking at them. Absolutely. So if you can see their range of motion, say you can only get here versus all the way, mm-hmm. It's is there a bony barrier there mm-hmm. that's stopping them? So we can take a picture and see arthritis and the joints closing down from all the bony growth that's happening. Mm-hmm. So if it's at the levels of C5, C6, and then it's impinging the nerve root, then your arm pain and your wrist pain is coming from the neck. It's not coming from your arm or wrist.
Right, and when we're talking about degeneration in the spine, so the disc and the bones, the reason that we have that is chronic misalignment. So the more we can keep things lined up, you work better and you'll last longer. Because if that spine's out of alignment, if we don't have that nice banana curve in there, it's going to affect the disc, which is that little spacing in between. It'll start getting thinner and thinner, and then we're going to have more stress on the joints. I say it's kind of like the wheels on the car. As long as they're in alignment, you can drive and drive and drive. If it goes out of alignment, I can still drive my car if the wheels are out of alignment, but what happens? It wears out.
Down.
Yeah, exactly.
So I'm going to show you some abnormal x-rays too, just see some of the things that is a potential that we could see.
Yeah. So on this one, what we're looking at, because we've talked about structure on the last one, this one we're looking more at soft tissue and inflammation. So this is going to give us a great idea. So if you look at the one on the pre, you see those big dark circles in there? That's inflammation. And if you look at the one on the right, the post, you see those dark circles are gone. And for this child, this is a 9-year-old, and he was having seizures 20 to 30 times a day. And we saw some things going on in there at the Wellness Way, and it's like, wait, that's not normal. Did some checks to find out why, did some tests to find out why that stomach and why that gut looked like that, and did some things to clean up some infection and remove some chemical stressors from food allergies, and the seizure stopped.
Yeah, that's amazing.
Very cool. Very cool.
So then there's one more x-ray we wanted to show you guys. So this is another neck x-ray. But
hi, Heather. Thanks for joining.
Hello. And so this one shows the before and after.
Mm-hmm.
So it's really cool because on this one, it shows you after they've been going through some treatments, and that includes adjustments, different rehab exercises, a couple different things to really work on their biomechanics and their posture. You can see there is a change.
Right. So that's very cool. She had a very straight neck starting off, and then after doing some work on it, she's actually starting to get some more curve in her banana. Not 100% done yet, but we're making some good progress with her. And you can go ahead and just that. Dr. Jason talks about how your cord lives in your canal, right? So he said if there's a change in the shape, it's like pulling a little string on your shirt and how it gets puckered up. So that's the same thing, the compression that it puts on the cord. So we don't want that at all. We want everything in its normal alignment. From the side, we should have those nice curves, and from front to back, it should be straight up and down. So that's one way very quickly that we can get an assessment, one of our very first tests, to get an idea about what the health of the spine, how the nerve supply is working, and then again for the soft tissues. Oh, let's go back and see if we can see her thyroid on that one.
On the first one?
No, medically. Yeah, that one. Cool. Wow, it's so tiny I can't see. Okay. So, but when we look at the x-rays, if you look behind the neck and in front of the neck, you see it's very dark. So air on x-rays is black. And then right below the jaw, we have a little bone. It's called the hyoid bone. And then right below that is the thyroid. And if we see calcification, let me just see if I can switch it over here. Can't really tell on that one. So sometimes these x-rays don't. Anyway, in the office when we have the x-rays up, we can look and see the status of the thyroid. Thyroid should actually be invisible on x-rays. So if we see it showing up on the x-rays, then that gives us a sign that the thyroid is under stress. So not that it's necessarily thyroid disease, but something is not normal about the thyroid. So that gives us another indication that we can look at. And then, can we go back to the other lumbar one? Mm-hmm. Yeah. So on this one, it's just more giant, big black circles. And that's a common finding that we see. But sometimes we'll actually see a little bit more speckling or a little more mottling, which can kind of give us an idea that maybe there's some constipation going on in there. And so this really can give us a good first glance and a first glimpse at what's going on with the GI tract. And we talked about the two gears again being nerve supply and immune system. And why are we looking at the gut for immune system?
Most of your immune system comes from the gut.
Like 80 to 90% of your immune system's in your gut, in your GI tract. So when that's not working properly, it can affect your immune system. It can be hyper, like too much, or it could be not working good enough, and you could have some immunosuppressive or immune type issues. So again, first glance, we can get a lot of great information, and we don't guess, we test. So this is a really good way right off the bat that we can test and get some good ideas about what's going on, and then where we need to go as far as how to get you back to normal, back to homeostasis.
Yeah, and even a lot of people I know that take x-rays too, you do it in the beginning to rule out contraindications to care,
Mm-hmm.
which means like, is this right, or is our treatment going to be right for you? Are you in our wheelhouse? Because things like tumors can pop up on x-rays, or fractures, a bunch of crazy things that the patients may not even be aware of that they have.
Yeah.
So it's great just to get that extra little bit of information so we can say, like, we want to help you. Where's the best route for you to go to?
And that's funny that you mentioned that, because so many times we'll ask about trauma and things like that, and they'll say, no. And then we'll take an x-ray, it's like, holy cow, what happened to this one right here? And they go, oh, yeah, totally forgot about it, So if it's not actively bothering them, they don't think about mentioning it. And so, again, some of the things that can cause inflammation that we can see in the gut, sometimes it's food allergies, and that can cause a toxic reaction. Sometimes it can be parasites. Sometimes it's not enough of the good bacteria. Sometimes it's too much of the good bacteria. It could be yeast and things like that. again, this will give us a good idea where to start looking, because we don't guess, we test. And when we find some things on the x-rays, that kind of gives us some direction about where to go next.
Yeah. So, if you have anything going on, maybe even just a little bit irritated, you don't have to live with that. So just come on in. We can get you checked out, see what's really going on with you, and the best route for care, because we can help you. And we want to see your progress.
Cool. One more thing, and then if there's anything else you want to add after this, but tonight we have our Wellness Way approach to inflammation. So like what we were seeing in those x-rays, we'd be happy to explain to you what that looks like, and from the Wellness Way approach, what do we do with it when we find it, and just some great information about what we do and why we get such great clinical results. So tonight, 5:30 here in the office. The next one will be in February sometime. Diana will put the link down there if you want to register. There's still time. We'll be starting at 5:30 tonight.
Yeah. So we look forward to seeing everybody there, and have a great day.
Have a great afternoon. Bye. Bye.